Hello everyone, Dr. Alan Mandell. Here, welcome back to my channel, Science of Healing. Have you ever wondered if every routine health checkup is really helping you? Especially after you turn 70, some tests might actually do more harm than good. Today we're diving into 5 health checkups that seniors often undergo but may not need, and the science behind why skipping them could actually protect your health. Let's get started. Most men are told that getting a PSA test is the responsible thing to do, a simple blood test that could save your life. But what if I told you that after the age of 70, this so-called lifesaver could actually become a trap, one that leads to surgeries, complications, and years of unnecessary worry? Imagine a healthy man walking into a clinic for his routine checkup, feeling secure and proactive, only to leave weeks later weighed down with anxiety, invasive procedures, and side effects he never imagined. The PSA test, or prostate-specific antigen test, was designed to detect prostate cancer early, and in some younger men, it has indeed saved lives. But for men over 70, the landscape changes dramatically. The truth is that many prostate cancers grow so slowly that they would never threaten a man's life. Autopsy studies have shown that in men over 70, as many as 60% may have prostate cancer cells in their bodies without ever experiencing symptoms. That's right, more than half of older men may carry cancer that would never cause them harm. Yet a slightly elevated PSA level can set off a cascade of tests, biopsies, and treatments that carry real, tangible risks. Consider this: a single abnormal PSA reading often leads to a prostate biopsy, an invasive procedure that involves inserting a needle into the prostate multiple times to collect tissue samples. It may sound minor, but studies show that biopsies can lead to infections, bleeding, and in some cases, hospitalization. One large study published in the Journal of Urology found that complications from prostate biopsies increased significantly in men over 70. Even more concerning, the very treatment meant to cure prostate cancer, surgery, or radiation, can leave men suffering from incontinence, erectile dysfunction, and chronic pain. These are not hypothetical risks. They are real, life-altering outcomes that seniors face when the PSA test is used indiscriminately. Why does this happen? The problem lies in overdiagnosis and overtreatment. PSA tests cannot distinguish between aggressive cancers that will spread rapidly and slow-growing cancers that will never affect quality of life. This lack of precision means that many older men are subjected to interventions that offer little to no benefit but carry substantial harm. The emotional toll is just as serious. Anxiety, stress, and the fear of cancer can dominate daily life, turning simple routines into moments of constant worry. Researchers from Harvard and the University of California have repeatedly highlighted that for men over 70, the net benefit of PSA screening drops dramatically, while the risk of harm climbs. It's not just about statistics, it's about lives. Imagine the man who could have spent his remaining years enjoying his family, traveling, and pursuing hobbies, suddenly tethered to hospital appointments, catheter bags, and the mental weight of complications that could have been avoided. PSA screening, once a symbol of proactive health, becomes a double-edged sword. But there is hope, and there is a smarter way forward. For men over 70, the key is selective, symptom-driven testing. Rather than undergoing routine PSA tests, seniors should have open conversations with their doctors about urinary symptoms, difficulty urinating, pain, or other changes that might indicate a real problem. This approach aligns with research from the American Urological Association, which recommends discontinuing routine PSA testing in men over 70 who are in good health and have no symptoms. Lifestyle choices can also play a critical role in maintaining prostate health naturally. diets rich in vegetables, especially cruciferous vegetables like broccoli and kale, and foods high in omega-3 fatty acids such as salmon and walnuts have been shown to support prostate health. Regular exercise improves blood flow and reduces inflammation, which can further protect the prostate. Staying hydrated, maintaining a healthy weight, and avoiding excessive alcohol or smoking can also reduce the risk of prostate problems, empowering men to take control of their health without resorting to unnecessary testing. Consider the stories of men who followed this approach, men who chose awareness over routine screening. They monitored changes in their bodies, stayed physically active, nourished themselves with a balanced diet, and relied on symptom-driven medical guidance. Many avoided the cascade of interventions that plagued their peers who submitted to routine PSA testing, living fuller, healthier, and more peaceful lives. The lesson is clear: sometimes less is more. In a world where medical technology advances rapidly and every test promises early detection, it takes courage to step back and ask, do I really need this? For men over 70, the answer is often no. The PSA test, while revolutionary in younger populations, can become a source of harm in later years, and choosing not to take it routinely is not neglect, it's wisdom. Science is backing this up. Large randomized studies, including the European Randomized Study of Screening for Prostate Cancer, show that while PSA screening reduces deaths slightly in younger men, the benefits diminish with age. Meanwhile, the risk of overdiagnosis skyrockets. The numbers are stark. For every life potentially saved by PSA screening in men over 70, dozens may undergo unnecessary biopsies, surgeries, or radiation. The medical community increasingly emphasizes individualized care, focusing on the patient's overall health, life expectancy, and personal values rather than blanket screening policies. The truth is emotionally powerful. We spend decades being told more testing is better, that early detection equals safety. But after 70, that message no longer holds. Our bodies change, and so does the way diseases affect us. Choosing to forego routine PSA tests doesn't mean ignoring health. It means prioritizing quality of life, minimizing harm, and making decisions grounded in science and compassion. It's about living well in the years we have, not chasing numbers on a lab report that may have little relevance. So, if you're over 70, take a moment to reflect. Talk to your doctor about whether a PSA test is truly necessary for you. Focus on lifestyle, diet, and symptom awareness. Embrace a health strategy that protects your body and your peace of mind. Because in the end, the goal isn't just to live longer, it's to live better, to feel vibrant, active, and free from the unnecessary burdens of overdiagnosis and overtreatment. The PSA test can save lives, yes, but only when used wisely, at the right age, and with the right guidance. After 70, wisdom may mean walking away from routine testing and choosing life in its fullest sense, informed, empowered, and unburdened. Colonoscopies are often described as a routine part of aging, a necessary step to prevent colon cancer. The image is comforting: a simple procedure, a quick test, and the reassurance that your body is safe. But for many men and women over 70, that reassurance comes at a cost that is rarely discussed, a cost that could outweigh the very benefits we seek. Imagine a man in his early 70s, healthy, vibrant, with no family history of colon cancer, walking into a clinic for a routine colonoscopy. He trusts the process, believing it is the ultimate safeguard. He feels responsible, he feels proactive, but the preparation begins hours before the procedure. The laxatives, the fasting, the dehydration, they are not trivial. For older adults, these can lead to electrolyte imbalances, fainting, and dangerously low blood pressure, and that's just the start. When the day of the procedure arrives, sedation is required. The sedatives, though generally safe, carry higher risks for seniors. Research shows that older adults are more prone to heart and lung complications during sedation. There have been cases where otherwise healthy seniors experienced oxygen deprivation or irregular heart rhythms during a colonoscopy. And then there is the procedure itself. The colon is carefully examined, but the act of threading a scope through the intestines carries a small but significant risk of perforation, a tear in the colon wall. In people over 70, the tissue is more fragile and the likelihood of perforation rises. Studies indicate that the risk of serious complications after colonoscopy doubles in adults over 70 compared to younger populations. Imagine the irony. A test meant to prevent cancer, intended to preserve life, becomes a trigger for hospitalization, emergency surgery, and months of recovery. The truth is even more unsettling. For many seniors, colonoscopies are repeated unnecessarily, often because guidelines are followed blindly. If a person has had clean results in the past, yet continues annual screenings, they are exposed to risk without additional benefit. Research in the Annals of Internal Medicine has shown that after age 70, and especially after 75, routine colonoscopies rarely prevent deaths from colorectal cancer in healthy adults. In fact, the majority of cancers diagnosed in older adults are slow growing, and the chances that screening will meaningfully extend life diminish sharply with age. Yet the fear of cancer pushes people to undergo these invasive procedures, believing that more testing equals more safety. Beyond the physical risks, there is an emotional toll. Colonoscopies are stressful. They trigger anxiety, disrupt daily life, and can even alter one's sense of dignity. Seniors report feeling vulnerable during the procedure, embarrassed by the process, and anxious while waiting for results. This stress is not trivial. It affects the immune system, blood pressure, and overall well-being. A procedure meant to protect life ends up eroding quality of life in ways that are rarely discussed by doctors or media. So what's the alternative? Science offers safer, more intelligent approaches. For healthy adults over 70, symptom-driven testing is often recommended. That means rather than undergoing routine colonoscopies, seniors focus on real changes in their bodies: unexplained bleeding, persistent abdominal pain, significant weight loss, or changes in bowel habits. These are the signals that truly matter. Stool-based tests, which check for hidden blood or genetic markers of cancer, offer a non-invasive, low-risk way to monitor colon health. They can be done at home, require no sedation, no preparation, and carry none of the procedural risks associated with colonoscopy. Studies show that when used appropriately, these tests provide effective screening for colorectal cancer in older adults without exposing them to unnecessary harm. Lifestyle interventions also play a powerful role. Diet, exercise, and hydration can significantly reduce the risk of colon cancer. Diets rich in fiber from fruits, vegetables, whole grains, and legumes support healthy digestion, promote regular bowel movements, and nourish the gut microbiome. Regular physical activity, even gentle walking or stretching, reduces inflammation and supports healthy colon function. Maintaining a healthy weight, avoiding excessive red and processed meat, limiting alcohol, and quitting smoking are all strategies proven to protect the colon. These daily habits empower seniors to take control of their health without submitting to invasive procedures that carry serious risks. Consider the stories of those who followed this approach. Men and women in their 70s who avoided routine colonoscopies but remained vigilant about symptoms, focused on nutrition, and maintained active lifestyles often experienced better quality of life. They avoided hospitalization, sedation complications, and the stress of repeated procedures. They were able to spend time with family, pursue passions, and enjoy their independence, free from the physical and emotional burden of unnecessary testing. The lesson is profound. More testing does not always equal better outcomes. In fact, for older adults, it can do the opposite. Colonoscopies, once considered a routine safeguard, must be evaluated critically in the context of age, overall health, and personal risk factors. Medical guidelines increasingly emphasize individualized decision-making. The American College of Gastroenterology and the U.S. Preventive Services Task Force recommend that routine colonoscopy screening generally stops around 75 and even earlier for those with other health conditions. For healthy seniors, the focus shifts from routine testing to attentive monitoring, lifestyle, and informed conversations with physicians. It takes courage to step back from what we've been taught to believe, that every procedure is necessary, that every test is life-saving. But the reality is stark. Unnecessary colonoscopies expose seniors to physical harm, emotional stress, and diminished quality of life. They rarely prevent death from colorectal cancer after 70. Choosing a more selective, symptom-driven approach is not neglect. It is wisdom. It is the recognition that longevity without quality is not true health. In the end, the message is simple yet powerful. After 70, routine colonoscopies may harm more than they help. Instead, focus on body awareness, pay attention to warning signs, adopt a fiber-rich diet, move regularly, and consult your physician about appropriate individualized screening strategies. Life after 70 is precious. Protect it with knowledge, mindfulness, and smart choices, not with blanket procedures that carry hidden risks. The colonoscopy, once a symbol of proactive health, becomes for many seniors a source of harm when used indiscriminately. And the real power comes not from blindly following routine tests, but from living intentionally, staying active, eating well, monitoring symptoms, and making choices guided by both science and wisdom. Because the ultimate goal is not merely to live longer, it's to live better, stronger, and free from unnecessary burdens. Understanding the risks of routine colonoscopies after 70 gives you the power to reclaim your health, protect your body, and enjoy the years you have with dignity, vitality, and peace of mind. The idea of a full-body scan is seductive, a single test that could reveal hidden dangers lurking inside your body. For many seniors, it feels like the ultimate reassurance, a technological guardian watching over every organ, every vessel, every cell. But what if I told you that for adults over 70, these scans could do more harm than good? Imagine an older woman, healthy, active, full of life, walking into a clinic and agreeing to a full-body CT or MRI. She expects peace of mind. She expects safety. What she doesn't realize is that this scan could unleash a cascade of consequences she never anticipated. Full-body scans are extremely sensitive. They detect abnormalities, yes, but they cannot distinguish between harmless anomalies and life-threatening disease. They see tiny nodules, minor lesions, and insignificant irregularities and flag them as potential problems. For someone over 70, this is a minefield. Many of these findings, known in medical terms as incidentalomas, would never cause symptoms, pain, or death. Autopsy studies have shown that up to 30% of seniors have small tumors or growths in the thyroid, kidneys, or adrenal glands that never affected their health. Yet once a scan identifies an anomaly, a chain reaction begins. Follow-up imaging, biopsies, specialist consultations, sometimes even surgery. Each step carries risks, discomfort, and stress. Consider the emotional impact. The moment a doctor says, "We found something concerning," fear takes hold. Sleep is disrupted, meals are avoided, anxiety rises. One small, insignificant shadow on an organ can dominate daily life for weeks or months. This is not hypothetical. Studies published in the Journal of the American Medical Association show that the majority of incidental findings in full-body scans lead to additional testing, and for seniors, these follow-ups are more likely to result in complications than in life-saving interventions. The psychological toll alone can reduce quality of life, impair immune function, and even affect longevity. The physical risks are equally real. Follow-up procedures often include invasive biopsies, which can cause bleeding, infection, or organ damage. Surgery, sometimes unnecessary, carries higher risks for older adults due to frailer tissues, slower healing, and increased vulnerability to anesthesia. Radiation exposure from repeated CT scans also accumulates over time, increasing the risk of future malignancies. A procedure meant to reassure becomes, paradoxically, a potential source of harm. It's not just about the numbers or percentages, it's about lives. Seniors have shared stories of scans revealing suspicious masses that led to months of anxiety, procedures, and hospitalizations, only for doctors to eventually conclude that nothing would have caused problems at all. Imagine the frustration, the fear, the lost months spent waiting, worrying, recovering from procedures that were never needed. This is overdiagnosis in its starkest form, a phenomenon increasingly recognized by the medical community as a serious risk in older adults. Research confirms the danger. The American College of Radiology and other leading medical organizations advise against routine full-body scans for asymptomatic adults, especially over 70. The evidence is clear. For people without symptoms, these scans rarely improve outcomes. The benefit is minimal, the risk is substantial, and yet the scans remain popular, often marketed directly to consumers with promises of early detection and peace of mind. The truth is, early detection is only valuable if it leads to treatment that meaningfully changes outcomes. For seniors, the vast majority of incidental findings do not. Instead of routine full-body scans, experts recommend a strategy rooted in awareness and symptom-driven care. Persistent pain, unexplained weight loss, shortness of breath, or new lumps and swelling are all signals that should guide imaging. Targeted, symptom-based scans reduce unnecessary interventions while ensuring that serious conditions are still detected early. This approach respects the body's natural changes with age, recognizing that minor irregularities are often benign and do not require invasive investigation. Lifestyle interventions play a pivotal role in protecting overall health. A balanced diet rich in antioxidants, vitamins, and minerals supports cellular repair and reduces inflammation. Regular exercise improves circulation, strengthens the heart and lungs, and enhances immune function. Stress management techniques, from meditation to social engagement, reduce harmful cortisol levels that can accelerate disease processes. These daily habits have far greater impact on longevity and quality of life than indiscriminate imaging. Consider the stories of seniors who embraced symptom-driven care and lifestyle strategies. One man in his 70s chose to forego full-body scans, but focused on nutrition, gentle exercise, and annual checkups that prioritized his symptoms. Over the years, he avoided unnecessary biopsies, hospital stays, and the mental strain of false alarms. He lived independently, traveled, and spent time with grandchildren, free from the constant shadow of imagined disease. These are real outcomes, showing that proactive, mindful health management can be more powerful than any scan. The lesson is profound. In medicine, more is not always better. High-tech tests, advanced imaging, and cutting-edge diagnostics are tools, not guarantees. For adults over 70, indiscriminate full-body scans transform potential peace of mind into anxiety, risk, and unnecessary procedures. Quality of life, dignity, and informed decision-making should guide healthcare choices, not fear or marketing hype. The body after 70 deserves care, yes, but care that prioritizes safety, relevance, and real impact. In the end, the truth is both sobering and empowering. Full-body scans, when used indiscriminately in seniors, often harm more than they help. Choosing to focus on symptoms, maintaining a healthy lifestyle, and making deliberate, evidence-based decisions about testing is not passive. It is intelligent, courageous, and life-affirming. It is the recognition that living well is more important than chasing shadows on a screen. So if you or a loved one is considering a routine full-body scan after 70, pause and ask, do I have symptoms that truly warrant this? Will this test change the way I live my life or my care? Choosing restraint, mindfulness, and symptom-based decision-making protects not just your body, but your peace of mind. It is a choice for dignity, for independence, and for a life lived fully without the burden of unnecessary medical interventions. Technology is powerful, yes, but wisdom in its use is more powerful still. And for seniors, that wisdom may mean saying no to routine full-body scans, focusing instead on habits, awareness, and medical care that truly matters. Because in the end, the goal is not just to survive, it is to thrive. To move freely, laugh often, and cherish each day without fear of what a screen might reveal. Informed decisions, grounded in science and guided by experience, are the ultimate safeguard. Full body scans can detect anomalies, yes, but after 70, knowing when not to test can be the most life-saving choice of all.